If you like this video, please click on the like button. Comment with the names of the movies you would like us to cover next. Click the subscribe button and press the bell icon to get notified of our latest creations. We cover 100 movies from around the world every day. To advertise with our channel, reach out to us. Our contact information is on our channel page. Now, let's move to the plot of this movie.
Fact-checking website PolitiFact highlighted 8 false or misleading statements made in the video. That Markovits was held in jail without charge. Markovits was briefly held on remand after an accusation of theft from her former employer, the Whitmore-Peterson Institute, but charges were dropped. There is no evidence to support her statement notebooks removed from the institute were planted, or that the National Institute of Allergy and Infectious Diseases and its director Anthony Fauci bribed investigators. When asked, both Markovits and Willis said it was an error to say Markovits had not been charged. She had meant to say the charges were dropped. Markovits later said, "I've been confused for a decade," and that in the future she would try to be clearer when she talks about the criminal charge. "I'll try to learn to say it differently." That the virus was manipulated. This possibility is still being investigated. According to Nature magazine, most scientists say SARS-CoV-2 probably has a natural origin and was transmitted from an animal to humans. However, a lab leak has not been ruled out, and many are calling for a deeper investigation into the hypothesis that the virus emerged from the Wuhan Institute of Virology (WIV), located in the Chinese city where the first COVID-19 cases were reported. That the SARS-CoV-2 virus evolved from SARS-CoV-1 within a decade, and that is inconsistent with natural causes. This is incorrect. SARS-CoV-2 is similar but is not directly descended from SARS-CoV. SARS-1 and the viruses have only 79% genetic similarity. That hospitals receive $13,000 from Medicare if they call it COVID-19 when a patient dies. This statement, which had previously been made on The American Spectator and WorldNet Daily, was rated half-true by PolitiFact and Snopes. Payments are made, but the amount is open to dispute and there is no evidence this influences diagnosis. The evidence suggests COVID the 19th of May be underdiagnosed. That hydroxychloroquine is effective against coronaviruses. This statement originates in work by Didier Raoult that subsequently received a statement of concern from the editors of the scientific journal in which it was published. The first randomized controlled trial to evaluate the efficacy of hydroxychloroquine for the treatment of COVID-19 found no evidence of benefit and some evidence of harm. The NIH said there is insufficient evidence to recommend for or against its use to treat COVID-19. As of May 7, 2020, other bodies were running additional controlled trials to investigate hydroxychloroquine's safety and efficacy. One that flu vaccines increase the chance of contracting COVID-19 by 36%. This statement is false. It misinterprets a disputed article that studied the 2017-2018 influenza season, predating the COVID-19 pandemic. The statement the flu vaccine increases the chance of contracting COVID-19 does not appear in the original article. The article's author Greg G. Wolf said coronavirus cases increased from 5.8% non-vaccinated to 7.8% vaccinated, with an odds ratio of 1.36, with 1.14, 1.63, 95% confidence interval. And the article highlights said, vaccinated personnel did not have significant odds of respiratory illnesses. The article refers to seasonal coronaviruses that cause the common cold. But COVID-19 was added by the website disabledveterans.org. That despite the goal of preventing coronaviruses, flu vaccines contain coronaviruses. In reality, there are no vaccines with coronaviruses. That wearing the mask literally activates your own virus. You're getting sick from your own reactivated coronavirus expressions. This statement is unsupported by evidence. Masks prevent airborne transmission of the virus, especially during the up to 14-day asymptomatic period when carriers may not be aware they have the disease. A virus may be deactivated, but cannot add to one's infection level if it leaves the body. Even temporarily. The journal Science also repeats some of the statements made by PolitiFact and fact-checked some of Mikovits and Willis' other statements. That Italy's COVID-19 epidemic is linked to influenza vaccines and the presence of coronaviruses in dogs. There is no relation between these. That SARS-CoV-2 was created between the North Carolina laboratories Fort Detrick, the U.S. Army Medical Research Institute of Infectious Diseases, and the Wuhan laboratory. Considering relations between the U.S. and the Wuhan lab stopped. The claim is false. That Mikovits is not anti-vaccine. According to Science, she once wore a piece of Vaxxx2 merchandise promoting the 2019 sequel to a 2016 film that says, MMR vaccines cause autism, and that she once sent Science a PowerPoint presentation calling for an immediate moratorium for all vaccines. That the Department of Health and Human Services, HHS, colluded and destroyed Mikovits' reputation. And that the Federal Bureau of Investigation, FBI, kept this secret but did nothing to help her. Science said, Mikovits has presented no direct evidence that HHS heads colluded against her. That Mikovits article on Science revealed that the common use of animal and human fetal tissues was unleashing devastating plagues of chronic diseases. Which the article does not say. That Mikovits' PhD thesis Negative Regulation of HIV Expression in Monocytes revolutionized the treatment of HIV, AIDS. The thesis had no discernible impact on the treatment of HIV, AIDS. Mikovits also alludes to several conspiracy theories that state Bill Gates is implicated in causing the pandemic to profit from an eventual vaccine, and makes false and unsupported statements such as the claim that beaches should remain open because of healing microbes in the saltwater and sequences in the sand that can protect against the coronavirus. The video states the numbers of COVID-19 deaths are purposely being misreported to control people. External videos, such as one in which a chiropractor says tonic water can treat or prevent COVID-19, and one of a press conference among doctors Dan Erickson and Artan Masahi in Bakersfield, California, says the COVID-19 pandemic is overhyped. These external videos were also disputed beforehand.